Assalamu alaikum everyone. My name is Sayyida Hiba Bukhari. Welcome back to my channel The Med Corner, and today in this tutorial we are going to be discussing about the osteology of the humerus bone. So first let's take a close look on the skeleton. So this is a skeleton which is having the 206 bone, and so the humerus bone is the bone of the arm. So this is the humerus bone, which is the bone of the arm, and it is the longest bone of the upper limb. It has an upper end, a lower end, and a shaft. So this is the proximal bone of the arm, you guys can say so. And the head of the humerus is articulating with the scapula over here to form the shoulder joint, and the lower end is articulating with the ulna. This one is ulna, and this is the radius bone. So the lower end is articulating with the radius and the ulna to form the elbow joint, while it is articulating on the upper side with the scapula over here to form the shoulder joint. Let's just isolate the humerus bone. So here is the humerus bone itself, and now let's just talk about the general feature of the humerus bones. So this rounded ball-like structure is called as a head of the humerus, which is located on the proximal end of the humerus. Should be placed on the upper side, which is going to be determine the proximal end of the humerus. So this blue rounded ball-like structure is called as a head of the humerus, correct? And it is going to articulate with the glenoid cavity of the scapular bone to form the shoulder joint. Now just beneath the head of the humerus there is the anatomical neck. So this structure marked over here just beneath the head of the humerus is termed as the anatomical neck of the humerus, while this yellow marked area is termed as the surgical neck of the humerus. So this yellow marked area is called as a surgical neck of the humerus, while the upper one just below the head of the humerus is termed as the anatomical neck of the humerus. Now these structure, this is called as a greater tubercle of the humerus, and this is said to be the lesser tubercle of the humerus. The greater tubercle is large prominent projection over here, and the lesser tubercle is a small bony projection over here, which is important for the insertion of some muscle, which we will discuss later in the muscles video. Now this structure, so the upper structure is going to be the proximal end, and the lower end over here is called as the distal end of the humerus, and between these two this green marked area is termed as the shaft of the humerus. And if you cut the shaft of the humerus into two halves, you will see that the upper one half is more like a rounded in shape, and the lower half is more like a triangular in shape. As you guys can see that on the upper side it is rounded, and on the lower side it is expanded. So the humerus bone is lower side is expanded, so it is more forming a triangular shape than the circular. So the upper half is circular and the lower half is triangular. Now this is the distal end or the lower end of the humerus bone, and which have the condyles over here, and they are going to be articulating with the radius and the ulna respectively to form the elbow joint. Now let's discuss about the borders and the surfaces of the humerus bone. So the humerus bone is having the three border and the three surfaces. So first, this is the anterior surface of the humerus bone, and the prominent border over here is termed as the anterior border on the anterior surface of the humerus bone. And there is a lateral border over here. If we take a look on the lateral side, so this is the lateral border just below the or around the greater tubercle of the humerus. And the third one is the medial border, which is located around the lesser tubercle of the humerus. So this is termed as the medial border. So the anterior border is present on the anterior side, the lateral border is toward the lateral side near below the greater tubercle, and the medial border is toward the medial side below the lesser tubercle of the humerus. Now let's talk about the surfaces of the humerus. So as I told you that there are three surfaces on the humerus, as this is the anterior border. So the anterior border, as you guys can see, is present in the middle, so it is dividing the anterior surface into the two half. So this surface over here marked in the sea blue color is termed as the anterior lateral surface, which is located on the anterior lateral side. So this is termed as the anterior lateral surface, and this surface over here, which is located in the anterior medial direction or side, is termed as the anterior medial surface. While if we rotate the scapula, so this whole surface is termed as the posterior surface of the humerus bone. On the posterior surface, there is an important landmark over here marked in the red color, is termed as a radial groove, which provides the passage for the radial nerve, as the radial nerve passes from the posterior surface of the humerus bone toward the forearm. Now if we take a look over the anterior surface of the humerus bone, you guys can feel that there is a tuberosity on the midline of the bone, which is termed as a deltoid tuberosity for the insertion of the deltoid muscle. Now let's talk about the distal end of the humerus and an important landmark present over here. So if we take a close look on the distal end of the humerus, you guys can see that this prominent part over here is termed as a capitulum, which is going to articulate with the radius bone. As you guys can remember it with the word CR. So CR is a class representative, but over here the C is the word for the capitulum and R is for the radius bone itself. So this is a trick I used to remember it. Now next to the humerus, this part is called as a trochlea, which is going to articulate with the head of the ulna bone. Now as you guys can see that there is some expanded area just around the capitulum and the trochlea. So these are terms as the epicondyle of the humerus bone. So this epicondyle over the lateral side is termed as a lateral epicondyle, and this purple marked area is termed as a medial epicondyle, which is located on the medial side. So on the basis of this side, they are termed as the medial and the lateral epicondyle, and you guys can see that the medial epicondyle is way too large than the lateral epicondyle. So medial epicondyle is bigger than the lateral epicondyle. Now just beneath the medial epicondyle, there is a groove over here marked in the blue color, is termed as the ulnar groove for the ulnar nerve. So this is a groove for the ulnar nerve, which provide a passage for the ulnar nerve to supply the ulnar bone. So this is the groove for the ulnar nerve. More than that, as I told you that this is a capitulum, so there is a fossa just above the capitulum, which is termed as a radial fossa. So you guys can remember it with the word CR. And on the trochlea, there is a fossa which is called as a coronoid fossa. As I told you that there is a coracoid process on the scapula bone, but here the word is coronoid, so you have to remember it that it is a coronoid fossa over here. And if we just rotate the humerus bone and take a look on the posterior surface, so here is also a fossa which is termed as a olecranon fossa. So this is all about the osteology of the humerus bone. I hope you guys understand it very well. If you have any query, then ask in the comment section, and if you like the video, then make sure to like and subscribe to the Med Corner. See you in the next video. Take care. Bye bye. Allah Hafiz.